Hello everyone. I'm urologist Omer Erdamakaya. The subject we will talk about today is gastric diseases and gastric medications, especially the group of gastric medications called proton pump inhibitors, which are the most commonly prescribed gastric medications in gastric ulcer and reflux. These gastric medications are used for a long time, that is, for months, years or even decades. When used, they reduce the patient's complaints by reducing stomach acid. When they enter the stomach, they paralyze the acid-producing cells in the stomach. This is how they work. So what is the function of the stomach? The task of the stomach is to digest the food taken from the mouth well, bring it to a certain consistency and present it to the intestines. If the food is well digested in the stomach, then the intestines can absorb the vitamins, minerals and proteins in the food well. If it is not digested well, the intestines may not be able to absorb enough. These medicines can also cause digestive problems. Like what? For example, they can cause vitamin B12 deficiency, magnesium and calcium deficiency. In fact, small-scale studies have shown that fractures may increase due to calcium deficiency. There are much more interesting studies. For example, there are studies showing that there may be a relationship between these medicines and dementia, stomach cancer, end-stage renal failure, gastrointestinal infections and pneumonia, and that they may increase these. A recent study has also shown that in men who use gastric medication for more than 3 months, it may decrease testosterone levels and increase estrogen levels. It may change the hormone profile in a way that may cause erectile dysfunction. As a result, if you are taking these medications and time has passed, if you feel erectile dysfunction or deterioration in erectile quality, it is useful to inform your doctor and have your vitamin and mineral levels measured. Maybe your doctor can change your treatment protocol or switch to a different treatment protocol. We should also say that when you use these medications, it is difficult to say that erectile dysfunction will definitely develop because of these medications. Erectile dysfunction is a disease that can have many causes both physically, mentally, and based on the couple relationship. It would not be correct to say that it will only be for this reason. At least I think that these gastric medications are worth considering. Thank you for listening, best regards.